Hey guys, this is Chris Dewey with May River Medicare. It is a gorgeous, gorgeous March 2nd, early spring afternoon in Old Town Bluffton. I'm at my office and I just want to reach out to everybody that has a Medicare Advantage plan. If you have a Medicare Advantage plan, just remember you only got a few more weeks left before you can make a change. You can use your Medicare Advantage open enrollment period, which is between January 1st and March 31st, to ditch the old plan and trade it in for a different Advantage plan that maybe is going to work for you better as far as your prescriptions, your doctors. The vast majority of folks that change during their OEP, which ends March 31st, they go from Advantage plan to Advantage plan. Why? A lot of it has to do with they didn't look at their annual notice of change. Drugs that were free last year are no longer even covered. They didn't look at the changes. So now they had a sticker shock when they went into the pharmacy and found out their drugs, that their gabapentin's $45 for a 1-month supply. So other reasons are network problems. For instance, a few years back, all my Humana Medicare Advantage clients, in the middle of the year, Hilton Head Hospital, Coastal Carolina, all the doctors around here stopped taking Humana. Tenet Health refused to take them. So there's a situation where a lot of clients that didn't change during OEP got stuck having to go to Savannah to receive care with a network provider because there were none in Bluffton or Hilton Head. So guys, I know a way, rather than take your junk Medicare Advantage plan and trade it in for the new bright shiny Advantage plan that looks so much better on paper. And it works great. These plans work great when you're healthy. But what happens if you get sick? That's when these Advantage plans, they break down. That's where they start to fall apart. And what do I mean by that? For instance, let's say you get cancer. Let's say it's October of next year, you're diagnosed with cancer. So with every single Medicare Advantage plan on the marketplace, the Advantage plan pays 80% of the cost of radiation, chemo, any kind of cancer treatment, and you're responsible for the other 20%. So with all these Advantage plans, most of them, your maximum out of pocket, which is how much money you'll pay out of your pocket before you don't have to pay anymore for the rest of the year until it starts the next year. So you get cancer in October and you start going to cancer treatment, you're going to hit that $7,500 in a month or two. So you're going to hit the $7,500 between October and January. Now, January 1st comes around and guess what? It starts all over again. So you're doing the chemo, the radiation, the experimental every cancer treatments. And again, they'll pay 80%. You're stuck with 20%. And you're going to hit the $7,500 maximum out of pocket in January. So I've seen clients spend $15,000 out of their own pocket between October and January, February. Okay? And the other thing with cancer, with the Advantage plans, you can't go to the Mayo Clinic. You can't go to MD Anderson. You can't go to Johns Hopkins. You can't go to the best treatment places, cancer places in the country. You are resigned to going to the local hospital in your local restricted network, and you can receive treatment there. All right? So a lot of drawbacks there. With Advantage plans as well, a lot of times a routine surgery that your doctor wants you to get is denied, and the insurance company says, no, you don't need the surgery. Instead of knee surgery, we want you to do rehab for 6 months, 3 times a week. And then after you do that, then we'll think about doing surgery. So the insurance company is in charge of the decision-making for your healthcare rather than you. Okay, so a unique strategy that I'm using for I'm utilizing it for a lot of my Medicare Advantage plan clients. This is an example because it happened to us. You have a zero premium plan, all right? Zero premium. And in January, no, let's make it March. March 4th, you call me and you say, hey, I got to get out of this Advantage plan, even though it's zero premium. I pay $50 for doctor's visits, $400 for hospital visits, and nobody takes the plan anymore. So you call me on the 4th. We apply for an Aetna Medicare supplement, the real deal. When you go to the hospital, you pay nothing. Pretty much just a couple deductible. There's a deductible, but that's it. So we go with the plan N. You go to any doctor in the United States that accepts Medicare. So we apply for it, all right? That's our first step. Then on March 12th, I get the good news. Aetna approves the policy since you passed underwriting. Okay, so Aetna approves and issues the policy on March 12th since you passed underwriting because I used my underwriting software and made sure that based on your health conditions, we found the one company, Medicare supplement company, that's friendly with diabetes. Let's say you got diabetes. I got you a real low rate with a company that accepted you even though you have diabetes. So remember, Advantage plans always end the last day of the month, and then your new plan starts the first of the month. Same with drug plans. So we spend the time, and I type in your drugs, and we identify a drug plan that fits your needs based on the medications you take. Unlike the Advantage plan, where they get a little cookie cutter, plain vanilla drug plan that doesn't cover any brand names, and they toss that in your Advantage plan and say, guess what? We got a zero premium per month plan, and it includes drug coverage. Well, who cares if it doesn't cover any of the drugs you take? So we're excited. We enroll in a Part D drug plan with SilverScripts, and we don't have to call Humana and cancel because at midnight on the last day of the month, that drug plan kicks in. That drug plan kicks the Advantage plan out. Because remember, Washington, D.C., you can't. They decided years ago that you can't have an Advantage plan and a drug plan. You can have either or. So the drug plan kicks out the Advantage plan, and on March 12th, the policy's issued. And I was smart. I said I don't want any money taken out until the effective date, April 1st. Unless you're 65, between 65 and 65 in 6 months, or 6 months after your Part B start date, that's the only time in your Medicare life that you can get a Medicare supplement with no health questions asked, no underwriting, okay? So with supplements, you got to answer yes to a bunch of questions. They'll do a med check. They can look at your background, but overall, it's relatively easy underwriting. I'm licensed with over 35 different Medicare supplement companies, so I have underwriting software that if you have issues, we'll find something that looks at your health conditions favorably. Okay, so in conclusion, first thing we're going to do this week is we're going to apply for a Medicare supplement. Once the carrier issues the policy, and I'll text you a Medicare supplement ID card right to your phone. Just remember, that supplement's not going to start till the first of the month, April 1st. All right, because right after we get the okay that you got approved for the supplement, then what we're going to do is enroll in a drug plan, a Part D drug plan, okay? And so that when we enroll that into that drug plan, it's going to kick out this Medicare Advantage plan. It's going to kick it out the very last day of the month. So March 31st will be the last day you have your Advantage plan. The drug plan will tell Medicare to put you in a drug plan for the 1st of April. You'll have original Medicare, which will pay first. The Medicare supplement will pay everything after that, other than you have a $233 Part B deductible, which every January that $233 starts. Once you hit that $233 deductible, your Plan G pays everything that Medicare does not pay. So you never have a bill. You leave your checkbook at home. All right, just a strategy that I'm using for a lot of my Advantage plan clients that were disillusioned by what their benefits entailed. So you guys have a great day. Call me at 843-227-6725. May River Medicare. Give us a call. Bye-bye.